Grace and peace be unto you, and peace from God, our holy parent. This is the day that the Lord has made, and we are rejoicing and glad to be in it. We today are gathered to talk about the effects of COVID-19 on people of African descent. This particular webinar town hall is sponsored by the African Descent Lutheran Association of the Evangelical Lutheran Church in America, and I'm Pastor Lamont Anthony Wells, and I serve as the national president of the African Descent Lutheran Association. And on today's webinar, we have with us Dr. Ulysses Burley, Pastor Tiffany Cheney, and Pastor Amsalu Gileta. And we're going to start sharing. A few weeks ago, we put together a survey that went out to many participants of ADLA and other members of congregations and supporters of ADLA. And some of the things that we began to find and talk about would be helpful for many of us to understand about how we are facing this particular pandemic. I'm reminded of a couple of things that Martin Luther said concerning pandemics, and he talked a little bit about fears. He gave two responses, if you will. He urged faith. And this is something that you'll see particularly in the evidence of the survey, that we as people of African descent have exerted historically an enormous amount of faith of knowing that the Lord will make a way somehow. And he also counseled, Luther also counseled that Christians should use reason and follow medical advice. And that's why we have individuals on this call that are going to give us some information to help us to understand how we should deal with this. And in Luther's argument, he even talked about civil order as vital in times of plague. So we want to deal with the political aspects of how we as people of African descent are facing this pandemic in our personal homes, in our congregations, and in our own physical bodies. Pastor Cheney is going to lead us now in some preliminary remarks about what the survey looks like and some of the early responses to the survey. Pastor Cheney.
Thank you. With this survey, we reached out to ADLA members and other members of our community to be able to understand how they were being impacted by COVID-19. We, in our initial response, heard from 70 participants with every ADLA chapter represented. We received a strong representation from the Los Angeles chapter with 37% of respondents coming from this particular chapter. We have 13 synods from across the country represented. We have had a few additional respondents to come in the last few days since this data was collated who are not included here. So the survey remains open, but these are our first participants and we are able to hear some from them today. One of the first things we asked was, how are you doing and how is your family doing? 91%, the vast majority of our respondents said that they were either good or very good. Half of those, of course, said that they were very good. When we asked about their families, the same pattern is reflected in the response for family members. 90% said either good or very good. However, it's interesting that when asking about family members and loved ones, they were more likely to use good versus very good. Now, I think it's important when we look at this particular response to consider some important factors about this survey and how it might have impacted how people responded. First, we consider the timing of the survey significant. This survey was released during Holy Week about 4 weeks ago, and most of our respondents took it during that first week. This is significant because it was just about this time, it was that very week that we were starting to hear some of the national implications on people of African descent. We were starting to hear that Black people were disproportionately more impacted by COVID-19. Also, I think it's important to consider the lens of hope that is typically a cultural value for people of African descent, passed down from our ancestors, that even in the toughest of times, to look at life through a lens of hope that could be reflected here as well. And then also, we know that people of African descent are less likely to talk publicly about their problems, which could also play into this result. Next, we asked about personal faith. So respondents mostly said that their faith was growing. About 3/4 of our respondents said this, and the rest said that their faith was about the same. No one said their faith was declining or diminishing. When considering the well-being of the congregation, a little over 1/3 said that COVID-19 was impacting the well-being of their congregation a great deal, and another third said somewhat. 19% of our respondents indicated very little as to how the congregation was being impacted by COVID-19. We now have some time for some points of connection.
So, Dr. Burley, when I looked at this particular survey and I reviewed it, and knowing the different aspects of we as a people, we tend to be more positive again about various things. So there's something that if you ask me how I'm doing, immediately I'm going to say I'm good, or that this concept of that we're fine. I remember early on, late January and February, many of us were kind of making memes and joking that this particular virus is not affecting people of African descent. And there were no numbers, and there's still no major numbers to really help us to understand the critical nature of this. Until later in March, when we began to hear and see, and actually Holy Week was this year. Holy Week 2020 was one of the deadliest impacted years, or months rather, and weeks of the particular responses or reactions to the pandemic. And I live here in Harlem, New York, and so we're in the epicenter of a lot of this stuff. So what should we be concerned about, and why, and what we can do about it? What's this whole issue of the pandemic and how it relates to Black people? What do we need to do about it?
Sure. Well, first and foremost, it's promising to see that respondents were doing well, and that their families were doing well, at least at the time. But as Reverend Cheney pointed out, soon after we would learn that people of African descent were not doing well as it relates to the COVID-19 pandemic. Reverend Wells, you mentioned the positivity of Black folk. And I'm not sure it's as much as positivity as it is we have gotten accustomed to operating at a deficit. And so anything beyond our deficit seems like a good thing, a good time, a good point of reference. And so when I was in a clinical setting, I used to see people with asthma, people of descent with asthma. I used to lead clinical research studies. And they would come in and we would ask them how they were breathing. And they would say that they were breathing fine, but when we actually got the numbers, they were almost not breathing at all. Mm-hmm. And to the point to where we would have to send them to the emergency room right away, but they had gotten so accustomed to breathing at a deficit that that became their baseline. And so I think that's relevant information when we talk about the ways in which COVID-19 is now disproportionately impacting people of color, but that our response to it might not necessarily suggest as such. And as a result, it causes this system to then discard our actual status, our actual feelings, our actual state as it relates to healthcare. COVID-19 is a global pandemic. More than 3.5 million people have now been impacted worldwide. Here in the United States, we have now exceeded 1 million cases with over 68,000 deaths and more than 153,000 people who have recovered. We now know, as data still begins to come in, that probably 1/3 of the United States total COVID-19 cases are among people of African descent. And so that includes both deaths, hospitalizations, and transmissions. If you break it down to
reported numbers, right?
Reported numbers, exactly.
There are people that might have it, but that are at home and managing it themselves.
That's absolutely right. If you start to break those numbers down to our urban epicenters, particularly where Black people are most populous, Philadelphia, Milwaukee, Chicago, New Orleans, St. Louis, Detroit, All of these places at some point were reporting over 70% of their COVID-19 deaths were among people of African descent. And so we are not doing well. And let me first state that there is nothing about our Blackness that predisposes us to disease, including COVID-19. Likewise, there's nothing about our Blackness that makes us immune to diseases like COVID-19. However, there is something about our Blackness that predisposes us to racism and discrimination and bias. And as a result of that predisposition, we then become more vulnerable to diseases like COVID-19. And thus we have this overrepresentation of people of African descent in this current pandemic.
Wow. So, Pastor Amsalu, so take us to the motherland, take us to the continent of Africa, and so again, the numbers have been low. Some countries like Ghana have fully reopened with minimal casualties. How prepared and ready of a response did the many countries in the motherland or nations in the motherland have, to your knowledge?
To my knowledge, I think Ebola had prepared them really well because it impacted disproportionately some of African countries. So when disinformation was happening about COVID is not impacting Africans or African descent, the leaders took it really seriously, and there were contact tracing, quarantine, universities and hotels changed to quarantine places. Travelers, passengers had to be in the quarantine for 14 days, mandatory quarantine, before they actually move on. I think helped, but again, it is not over yet. So I don't want to be overly optimistic, but it seems there is preparation for it and it is working.
Okay, good. And so many people, this affects so many people, but people who are right on the front line, who can't get away from this, are first responders, right? And particularly disproportionately, many of our first responders, particularly in certain types of work, as essential workers, are people of African descent. Reverend Cheney, how are they affected, and how can we help, our aunties and our uncles and things who are nurses, and what can we do?
So I think when we think about first responders as it relates to COVID-19, that covers now many different kinds of industries. Grocery stores and banks and so on. I particularly served in a healthcare organization. As I think about it from the lens of a healthcare organization, what we can do is to listen to our public health officials as it relates to guidelines about social distancing, about using face coverings and so on. That the best thing we can do for our first responders is to stay out of the hospitals if we can from being sick and overrunning them, right? So the big narrative of COVID-19 from the beginning was trying to protect the surge of capacity within our ICUs. You've seen the graph, you've heard the language about flattening the curve. Flattening the curve is all about making sure that our healthcare organizations, that our hospitals are able to handle the capacity of patients that come. And what it also means is that for many of our healthcare workers personally, there are so many who are choosing to stay separate from their families in this time, if they can. Here in Montgomery, where I live and serve, we have a local college, Auburn University Montgomery, that has provided housing for healthcare workers who are afraid to go home with their families during this time because they don't want to be carriers of this virus to their families. My hope is that by us all working together as a community, by us all social distancing, using face coverings, making prudent decisions about how we engage together in community, we are able to allow this virus to work itself to the point where it's not such a burden on our healthcare systems, and so that our workers can go home comfortably and confidently and be with their families, that our hospitals and our emergency departments, our urgent care clinics and so on are able to trust that they can handle the demand of patients as they come, to listen to good advice that comes from our public health professionals and make smart decisions about how we engage during this time.
Good, thank you. So this period of quarantine for many of us feels like oppression, right? It's for some, right? Like we can't do the things that we want to do. We can't go the places that we want to go to. So for me, I've tried to reframe like what I do during this period of time to reevaluate myself and reevaluate my ministry. So I talk about the preparedness. Well, I'm an only child, so I was prepared because I've been home, by myself, as a latchkey child for many, many years. But our government, people are talking about, was not as prepared as it should have been or could have been, right? And there are various news reports, and I believe more will probably come out later about when our government leaders knew about this and what could have been done, the preparation for PPE and other things like that, those stockpiles and how those should have been made more readily available. Also with testing, that has to also increase, and we're not up to par with that. Forget a vaccine, we know that takes time to manifest. But I'm concerned as I look at this survey about the church's response to this. How prepared do you all think, just in your own gut, that the church was to this or for this? I look at some of our historically Black denominations like the AME Church. Dr. Miriam Burnett is their healthcare specialist and minister, and they were already prepared with white papers, if you will, that spoke to this. And to my knowledge, I've not seen any blue paper or white paper yet that really helped us as Lutherans to be prepared for this. They were prepared because they have relationships with countries and nations that already deal with pandemics like this. How prepared do you think we are, and what do you think surprised the church the most? Everybody.
I think one of the surprises, and we'll see this as we get into more of the results, is understanding what it means to gather when we can't gather in person, and understanding what it means to have nimble ministry. I've watched businesses that have flipped in this community to be able to serve the community differently. How nimble were we as a church to be able to think about what it means to serve when basically overnight, or certainly within a couple of days, we can no longer gather in the ways that we've been doing since ancient times.
So I think our people, community gathering in person is the center of life. Life is community, and community is life. And the church is the center of that community that binds the community together. So not to meet in person actually have an impact on all of our communities. In most cases, or in some cases, the church is the provider of all safety nets too. So for that purpose, I don't think the churches are prepared for the converting quickly to online services or virtual ministries. Although it doesn't require a whole lot. I mean, as long as we are flexible to do those. So that is what we are observing. There are some who are actually proactive and took advantage of and just use what they have to adapt. But still, that community in-person gathering is very important to us, or to people, to our people, that that has an impact in totality.
Dr. Burley, I'm concerned about, you and I have worked together with our HIV and AIDS initiatives in the ELCA and beyond. And I'm very concerned about the other side effects or reactions and things that will exacerbate because of COVID-19 and the whole quarantining and social distancing or the lack thereof. I'm hearing about parties everywhere, even up to freaknik proportions in some areas. And so I'm very concerned about other areas that you think are going to grow because of this. Like I hope this is not true, but I'm thinking that some sexually transmitted diseases. I've heard a friend of mine from Philadelphia who works in healthcare said there has been an uprise in syphilis cases this just in the last month or so. What do you think some of the other effects of COVID-19 will do for us regarding other areas of our health?
Right. So this is what we call the social determinants of health. And those are the structural conditions in which people are born, learn, grow, and live. And it includes their neighborhood environment, their economic stability, their level of education, their social contact, as well as their access to health and healthcare. And so not necessarily the effects of COVID-19 on our physical selves, but how does COVID-19 then affect structural systems that manifest as other forms of dis-ease, if you will. And so you mentioned people living with HIV and AIDS, which is my expertise. And so I've been a part of a lot of conversations around making sure that people living with HIV are not forgotten. As of right now, physicians, public health experts, scientists who would otherwise usually be working on the HIV and AIDS problem have had to shift for an all hands on deck type response for COVID-19. As a result, there are people who still need HIV and AIDS care who cannot otherwise receive that care as a result of that shift. And so then there becomes a question of access to much needed care, access to life sustaining treatment, access to even prophylactics, as you mentioned. And so you start to see other sexually transmitted infections increase, especially as people are confined to their homes. You know, that becomes a level of escape when you can't actually physically escape your setting. And so these definitely are consequences, and they're consequences that will impact people of African descent more because they were things that impacted us more already. So this just becomes a compounded effect. But even more than that, you know, we talk about our response right now. This is going to have ramifications beyond COVID-19. You know, we will get to a point where COVID-19 is history, where we have the science we need to stabilize and make COVID-19 a chronic disease that's manageable and treatable. But after that, there will be casualties. There will be families that are never the same. There will be people who have recovered, but their health as a result will never be the same. And it will require long-term care that they might not have access to. It will require a level of resources that aren't currently available. And so when we think about our African descent populations and our needs, not only right now, we have to be thinking about after the fact. The same way in which we have continued to consider victims of 9/11, the same way in which we have continued to consider victims of Hurricane Katrina, even when you begin to date back to, you know, workplace hazards like asbestos exposure. And after learning that there were certain kinds of people who had been exposed to this carcinogen, that they would then need a fund for the rest of their lives to not only sustain healthcare, but to compensate them for what we did not know then, what we know now. And my guess and understanding of this particular pandemic and the types of people that it is impacting, frontline workers, essential workers, which people of African descent are overrepresented in. Also industries that don't provide health care or paid leave or things of that nature will then need those kinds of resources long-term as a result of being disproportionately exposed to this virus. And so I think that begins to be a connection point for our churches in terms of advocacy.
Yes.
At the state and federal level, advocacy around policies, advocacy as it relates to the ongoing conversation around reparations, right? Reparations might look like medical benefits, right, in perpetuity as a result of people of African descent continuing to be overrepresented in these, in all the worst categories as it relates to our physical health as a result of, and I always have to bring it back to systemic and systematic discrimination and racism.
And these are facts. So we're lifting this up, you know, and I wrote an article a couple of weeks ago, and I start talking about the disproportionate nature of how this will overwhelmingly affect people of African descent. And some people may have taken that to read it as, this kind of competition. Oh, this affects us the most. But like, it's about advocating and calling this stuff out as harsh realities, not for sympathy. We don't need the sympathy, right? You know, because we've got to we've learned how to encourage our own selves in the Lord. You know, we see that through the survey. But these are realities, and if there's ever a time that we need to be speaking, not just about how Black people are dying at disproportionate rates with COVID-19, but the other things that will affect. Because one of the things that comes to my mind is with so many other health-related issues, diabetes, hypertension, and things like that, and the pills and the things that many of us take just to manage our lives with that. Many of these things, and we don't talk about the pharmaceutical industry, actually don't balance well together, right? So just imagine having to take a diabetic pill, a blood pressure pill, and then get a vaccination or injection, you know, for this. And what are those effects, you know, that it has to the body? So we have much to be concerned about and much to advocate for. ADLA has worked closely with our EOCA advocacy office, trying to get more information about the effects of this. We've called the CDC and tried to get and to lobby them to pump up the information, which I do believe they have. I just believe that it's being suppressed. And so these are the kinds of things that we need to keep lifting up, because this is a marathon, and this is an opportunity for us to highlight and share the need and to advocate and to make a difference and make a change in these things around us. Pastor Cheney, let's talk about our priorities, what people said that were necessary for our priorities as people of African descent, and where we may need to go from here and how it's affecting us.
So we asked our survey participants what was the greatest priority for their congregation right now. And again, we're speaking 4 weeks ago as far as when most of the respondents took the survey. And there were two major themes that emerged. One was communicating messages of faith and hope in the midst of crisis. And the other was updating technology for streaming service and online giving. So we've talked some about the technology piece already. That will continue to be a theme. The focus has really been on finding new ways to connect, to be a faith presence. We then asked about staffing decisions. We asked both for lay staff and for pastoral staff. And in asking about what are some of the decisions that the congregation has had to make. With lay staff, most indicated that there was no change as of that time, but where there was change, the change was in a reduction in staff hours. For pastoral staff, more than half said no change, but again, where there was change, it was a reduction of paid hours. It's interesting to note here the language that it's not hours worked, it is paid hours. But I think it's true both for our lay and our pastoral staff that so many people have been involved in figuring out how to, connecting back with the first slide of the greatest priority, how to translate to a technological platform for sharing messages of hope and faith, that there's been plenty of work done. The question is, how is that relating into the ability to pay for that particular work that is being done? And again, valuing not just our pastoral staff, but also administrative staff as well.
So when we begin to look at our congregations, and we estimate that there are about 500 or so total congregations that have at least 10% people of African descent, and generally about 155 or so that we would consider predominantly churches of African descent spread across this country in all the particular major urban centers or major larger cities within these yet to be United States. Amsalu, I'm on the impression as a director for Evangelical Mission, and that's why I'm kind of coming to you now, that many of our congregations already had some pre-existing conditions. They were struggling in financial ways, although giving at disproportionate ways, and we'll talk about that a little bit later. But because of white flight, they end up inheriting an albatross of a building that is in disrepair. When we looked at the responses to lay staffing and professional staffing or clergy staffing, the reality is most of them are solo staffed, right? So they don't have the option of laying off staff. If you're going to lay off anybody, it's the pastor, right? Because that is usually that person there, and that person generally is not full-time. Or as we talk about meeting Senate guidelines, which are minimum pay requirements that on average, the majority population receives more above than we actually receive as people of African descent or people of color, less than. So how can we, Amsalu, prepare now to grow ministry and meet the needs of this present age?
I think you hit the point by saying that it pre-existing conditions. As you said, the building, financial status, and all those things that most of our pastors or congregations are not paying their staff at the guidelines out there, and or some of them are actually doing paying some of their expenses through the grants that are available to them. So from the beginning, they are at a disadvantage point, but congregations are doing so many creative works. So what I just wanted to highlight, not only the negative that is out there, but also what they are doing. Some of them are collaborating rather than being in a silo and doing things as, this is my territory, my own, but they are collaborating and doing some works together. So which will prepare us to, maybe there are things that we can do, sharing the stuff or sharing the resources, the know-how. The second thing that we need to look into is the power of laity and deploying the resources that that we have in congregations. For example, we have many technology experts in our congregation, people who are media savvy in our congregations, who can flip their phone and do live stream the services, or maybe even connect us from our home to the digital world and stream our services. So those who are editing and all sorts of things. So how are we best use of those resources that are already in the congregation? These are the examples that we are lifting up now because of the crisis we are in. But what are the things that what are the gifts that are already in our congregations that we are not using? Not because it doesn't fit what we said, this is how the church is done in a traditional sense. Most congregations or churches out there globally are using the growing because of the ministry of the laity. So how can we deploy that in our congregations? That is one thing that we can prepare for. In the meantime, though, I think we encourage our congregations to take advantage of resources that are available. There are federal resources for PPP. There is the state resources, local, county, or city, wherever we are. There are resources that are available from the government. There are also synodical and church-wide resources, especially for this time. So if we are in need of, which our congregations already are in need of, but now more so, and the larger church is also providing resources and paying attention to our needs. So I think congregations should look into those resources and use that so that we can be even more prepared for the ministry that we are doing now, but also for the ministry we will be doing after this pandemic is over.
I think that's very important. I'm a firm believer that where there's vision, there's always provision. So when we talk about these greater priorities and the purpose, which you talked about and lifted up, seizing some of these opportunities. So I think now more than ever, one of the things that I could see many of the churches of color and all churches, every pastor needs a therapist and a coach. Like, so somebody to sit there and depress all the stuff that we deal with in our own personal stuff, but also one who can guide us, to push us, to organize our lives and our missions and our ministries to be more effective. The other thing that I wanted to say as you were talking about is we have to do things differently and not alone. And I believe that more than ever, we're going to find out now, and these are relationships that need to be engaged now. And hopefully they were engaged before with our ecumenical partners and with our church's effort to deepen relationships with historically Black churches. When I think of, I'm here in New York, again, in Harlem, we have one of our oldest Black Lutheran churches, the former Transfiguration Church, Christ, now called Christ Center, and was developed as a new start. And I think now is a time more than ever that churches that are fledgling like that would yoke and begin to make stronger connection with our ecumenical partners, realizing that we don't have to do this alone. And it may come to a resource redistribution that would allow both of us to come together, or multiple amounts of us to come together, so that we can become stronger and serve the greatest need. So I think those are things that we're going to have to clearly look at and articulate. The thing that concerns me, though, is if because of some of those pre-existing conditions, if some of these churches don't make it, I'm very concerned about how those resources will then be reinvested in communities of African descent. I have seen far too many times when synods, not just in Metro New York or New England Synod or other areas, and I call them because I know them, is the fact is that they have used resources and have amassed resources off of the backs and the benefit of selling property and other things that predominantly have come out of communities of color. Disproportionately, they've engaged that. So that's a concern that I have, and as ADLA president, will be watching and after this pandemic surmises or comes down some. Ulysses, we have a church culture in the ELCA, particularly of professionalizing ministers. I don't know why we have it, because deep in our DNA as Lutherans, we believe in the priesthood of all believers. So I don't get how we became a church that professionalized ministry. I mean, we got lazy somewhere in time and history, and we became this us and them kind of thing. But How should lay people be preparing and sharing gifts in this age?
Sure. So I'll speak from my personal perspective as a lay person who serves as a leader in a church that does not have a pastor, in an African descent church that is not fledgling, but is definitely considering other models to sustain for the foreseeable future as we engage a membership that is aging, membership that is quite frankly dying, and a membership that is not birthing new membership. I've been fortunate enough to be affirmed in my leadership as a lay person, to where my gifts are not only used, but my ideas are heard and valued and even implemented. I don't know that that's the case in many of our churches. We like to exploit the gifts of youth, but we don't necessarily allow young people to operate outside of the gifts that we only deem valuable to our ministries.
Okay.
We have a lot to offer, and I benefit from a fellowship that allows me to give everything that I can offer. And I believe one of the reasons why we've been able to sustain not one, but two departures of pastors in the last 5 years is because of a congregation that has leaned into allowing lay people with gifts to serve fully in their gift without the pressure of formalizing the call, forcing people into seminary and these other things. And so I think, we are a generation of freedoms, and we are a generation outside of the box. And I think we exist in a faith model that has very much so been boxed, and not just in our confession, but in Christianity as a whole. And I think that as we can begin to tear up the box, if you will, we will see the reimagining of some of our faith houses in such a way that allows them to sustain in a 21st century while still operating on a first century theology. And so, it's a matter of not them and us, but we, right? And understanding that there's wisdom in age, but there's also some wisdom in youth, and being able to affirm that, I think, is what gets young people back into our church houses. And I say back into our church houses and not back into the faith, because we haven't lost faith. I think that's a misnomer, because we don't go into faith houses that we don't have faith. We've just found faith in other places that more so align with our sensibilities as millennials or Generation X. And so it's really I think COVID-19 has presented a teachable moment, where in which we were all forced to reimagine ministry in a new way, a way in which perhaps is more suitable to the gifts of young people than our elders. And in doing so, it has allowed us to relent to some practices that maybe the church wasn't otherwise open to. And I think that that's a good thing. I just hope that we maintain that flexibility, that agility when we come out of this.
I think what you bring, this affirmation of laity, You know, there has been studies, Pew studies, Lilly studies about the dissonance within the clergy community, and many of them are leaving faster than ever. And I think we should pay attention to that. But I also don't think that we should ignore what's going on with our lay community, the laity, because particularly many of the, historically, especially for people of African descent, lay people have had this opportunity to be leaders and to learn how to be leaders within their communities and congregations by working and serving in ministry and church. And that should be affirmed in various ways. So I do encourage that. When we look across the board, many of the fastest growing church and Black church in particular, and one of the fastest growing churches in America is still the Church of God in Christ, right? And there are other churches, you know, the historically Methodist churches, AME Zion churches, where many of the leaders have had to become bivocational in order to do ministry. Like they started out that way. They started out working at the plant somewhere and became pastor in that community and kept on doing that for many, many years until ministry grew to a point that it was able to host and support a full-time leader, or ministry became necessary for that. And many end up staying in that capacity. It's a little bit the opposite in our community, where the expectation is that the minister, rostered leader is full-time, he or she, you know, has full benefits and will spend an enormous amount of time operating and leading the church. Reverend Cheney, do you encourage more bivocational ministry as a way to promote sustainability? Because that may be the real option that we need to look at. And again, it's working in other churches who are growing.
In fact, I do. As a mission developer, Gathered by Grace, the ministry I have the privilege of serving, is intentionally one that was formed with a mission developer who is bivocational. When I had the opportunity to come back to Montgomery to explore ministry, the part of the model for how this ministry has formed has been with me as a part-time mission developer and part-time serving in a healthcare context, as I mentioned earlier. It has caused a different kind of a lessened budgetary pressure on the mission development. There are some things that we have been able to grow and to form and to explore that has been done in a way that is very different than one that has to hold the full weight of salary and benefits for myself. And so with that, it has been a privilege for me. It is a privilege for me to be able to serve in a way that allows me to be bivocational. Personally, it allows me to be able to use a wide variety of gifts. I believe God has called me to all the ways that I get to serve, which now I use multi-vocational because it seems to be growing every day. But with that, I am getting to use a variety of different kinds of gifts to serve the church and the community. Now, I'm very intentional to say that in many ways, my bivocational context is the exception, not the rule. Because I'm a second careerist, I returned to a first career when I came back here to Montgomery. What that means is that I have a sustainable second career. For so many people so many pastors that consider bivocational ministry, it's not necessarily a sustainable second job. And that can be very, very hard if it's just a means of earning a little extra income. Part of the reason why it's difficult is because of realistic expectations. The other thing unique about my setting is because I was a developer forming ministry from scratch, it meant I had the opportunity to shape the culture of this ministry. Gathered by Grace has never had a full-time pastor. This ministry does not know what that looks like because it's never been a part of the shape of this ministry. Conversely, if I were in an established congregation where I had been full-time and then the intent was to shift to bivocational part-time ministry, now we have to start talking about expectations. It means that you're not able to be present in all the ways and spaces that you have been before if you go from full-time to part-time. So I do think bivocational is an important model to talk about when we talk about the health of our churches and of our leaders, but I think it's important when we do so that we set realistic expectations. In the last 4.5 years or so that I've served in this context where I've been bivocational, I probably have said no more than anything that I've in any other time in my career. Because in order for it to balance, there are plenty of great things that I had turned down a writing opportunity last week just because I don't have the capacity, particularly in the midst of COVID-19, to be able to think about what it means to be a healthcare leader and what it means to be a pastor and to do it all. I have to say no. I have to think about those kinds of things. Well, what does that mean during that time when the congregation desires for me to be present in a particular way, if we're thinking through a traditional congregational lens, but there's a schedule at a job that says you're working on Friday from 8 to 5, whatever the case may be. So I am always hesitant, I've written about this before, that in the same way that I encourage bivocational ministry, it's something that we should think about. I'm also very careful to say that when we do that, we need to do that with realistic expectations.
And I just wanted to kind of add two observations on those topics that we have been discussing. As a church also, as a larger church, we need to talk about leadership development for lay, what it looks like. And because it is good to affirm leaders in our congregation, but there is also, we have to talk or maybe have some system to equip leaders to do and fulfill the call. The other, along that line, what Pastor Chen is saying about the bivocational. So
now,
that
multivocational.
Multivocational. Okay, all right. There is expectation from the congregation, but there is also, as a director for evangelical mission, there is expectation from the synodical part of it, from the church-wide part of it. So I mean, it doesn't. There are things that doesn't fit the system. Mm-hmm. So we have to talk about those and come up with, here are the things that, I mean, the things we should or shouldn't do when we talk about bivocational. We have to address that so that we don't overburden, and we say that so-and-so is bivocational or multivocational, but also expect the same kind of report, the same kind of expectation from the person also, because that will, I mean, or the congregation for that matter.
That's so true. There's really no such thing as a part-time pastor. That I've never understood what that even looks like. Even now, would you just quickly say, we're going to get ready to go to our next slide, but even now, would you all say that, you know, people are talking about board, I'm in the house, board in the house, and like I feel like I'm doing way much more work than it was when I was in my normal routine. Like I have been on.
I just want one more day to come.
Right. I am not more. I am more. I'm sleeping better because like it's wearing me out. Like I am worn out, and you talk about what, and I hear what you're talking about actually, because as Pastor Cheney had to learn to say no. I'm this week practicing. I got my passion planner and I'm ready to say no to meetings. I'm on like 6 to 7 Zoom calls a day. I can't sit up there. I mean, this call is about to end shortly because I'm getting worn out. But that's the reality. I feel like I'm working more. Would you all say the same? Yeah.
Absolutely.
I would say that. And that was part of the reason why in that last slide that I reviewed, that I was intentional to acknowledge that it's a difference in paid work hours and actual work hours. Just because everybody's not being paid for the same amount of hours does not mean that people are working fewer hours.
Right. And just before we go to the next, the thing about the lay part, that includes like musicians, the lay staff workers, musicians, sextons, and all that. Now, it concerns me most because when we talk about going back or whatever we go to, whether those people will still be around or have made other shifts, and those are critical, those are essential workers. Ministry workers to the church. You can't have a church of African descent and don't have a good musician, right? Or multiple musicians. I mean, that's necessary. There's no such thing as having an a cappella worship service. I mean, we do our hand clapping and foot stomping, but we need that Hammond B3 or that piano or banjo or something going to do ministry. So how we take care and how we're prepared to take care of those leaders, those staff members, is also very important. And then think of our sextons too, who are going to have to learn a different set of skill with a little bit more elbow grease, I guess, or whatever, and cleaning differently. And the cost of certain types of chemicals and stuff that will make our churches safe for us matters to us in ways that we have to pay attention to. So we've got to look at the staffing models for our future, not just for clergy, but also for other leaders that are staff in our community. Pastor Cheney, you want to go to our next slide?
Yes, next we want to talk about ways of encouraging generosity. So the good news here is that half of the respondents already had existing online giving platforms in place that they were using prior to COVID-19 impacting how we gather together. And so for those particular congregations, they just had to direct their givers to their existing online giving. 13% of the respondents said that they have since implemented online giving for the first time. So we're glad to see that they were able to take on those new platforms. And I think it's important to recognize, again, remember, we're talking 4 weeks ago for many of our respondents, which would have been only 2 weeks or so after the time that they would have stopped worshiping in person. So what that means is that they very quickly implemented online giving so that they could continue to offer opportunities for generosity. This is important. I use the phrase all the time that we have to be able to pivot as we juggle, that the things that we juggle continue to come, but being able to pivot quickly is an important skill that's necessary as we maintain how we move forward. So for those 13%, they did that. Then we've had another 13% that at that time did not have specific giving strategies, and then 10% who were using more traditional methods of mailing in, offering, or dropping it off at the church. As it relates to congregation growth, the area of most growth for congregations has been in innovation around technology, consistent with the things that we've said so far on this time together. That comes in using Zoom or social media or conference calls for small groups. And there's really plenty of opportunity to continue to increase it if we continue to focus on doing this well. As it relates to congregation survival, 3/4 of respondents are confident or very confident that their congregations will survive COVID-19. 20% are unsure. This again gives us an opportunity to think about what survival looks like and what sustainability looks like. And then I think in the same way that we heard from Dr. Burley earlier about what it means for us personally as we have this lens of hope, I think that's also true for our congregations of how are they breathing before and then how are they breathing now and the lens through which they look. When we talk about congregation attendance, 43% of the respondents expect their congregation to grow following COVID-19, and 31% expect attendance to remain the same. This causes us to think about, again, how that ethos of hope and faith might lead people to re-engage ministry that may have been de-churched before, that are unchurched before, that might want to engage differently at this time, particularly how we maintain the expanded digital connection, engage people that may have been become a part of our communities digitally that were not a part of our communities in person, and how we keep those relationships as we have the opportunity to transition back into our buildings.
Wow. These are very important pieces to pull out as we bring a bit of closure to this discussion. When we first talked about generosity, one of the things that I want to make clear that came out of this survey and other prior surveys about how people of African descent give, and people that are in poverty and other marginalized communities tend to give a higher percentage of their resources and income towards charitable organizations. So it's a misnomer that if any grant is given, any, type of stipend or, assistance occurs, it's not that we are on the receiving end, but we have disproportionately contributed towards the bigger pot, if you will, or benevolence or mission support, and however you may. So that's a very misnomer. I remember even having to change language of when we receive grants or receive assistance from the churchwide office and calling it welfare. And there's no welfare, it's about investment in the communities that we're a part of. We're one church. So when we look at the statistics that we tend to give more, and we are, and volunteer more in other particular areas, Pastor Amsalu, how can we have a more honest conversation about money and volunteerism and giving when so many of our people are in need? Although the scripture teaches us you have not because you ask not, how can we have a deeper conversation about how we give and our participation in generosity?
I think when we think about generosity, we think about having and giving out of the more we have. It's not about giving from what we have, but it is an act of faith, an act of. So one person once said, "Don't hinder somebody's generosity and accept what." And sometimes as a church, we do hinder also. I am afraid that we hinder the generosity of our congregation. What I mean by that is that we have to be honest and tell them the reality, but also care for them. Appropriately. Think the widow and Elijah, and that is the powerful thing. At the same time, so giving is the sign of spiritual health. We care for our congregations, but we show them, we tell them the stories of their giving. This is what tell the stories of the generosity, the act of generosity. It's not the lack of it, the act of it, what we accomplish by the generous support of the members that what we do. The other thing that I wanted to say about generosity or giving is that some of our congregation may not have the platform for giving. As a ELCA, we kind of partnered with Tisely, and they are providing and helping, assisting, even the platform, providing the platform for our congregations to do that. So I think communicating that to our congregation is important. In some cases, especially in the synod I serve, for those who don't have the platform and cannot put up the platform right away, we provided on our synod's website that people could give that. So the money goes to the particular church, but we provided the possibility of doing that. So that is also possible. Congregations also partnered to do that. In some congregations said, "Oh, hey, We have the platform, and we can help others to do that. So along that line, the PowerPoint you shared, Pastor Cheney, about our congregation's confidence of survival. Some said, okay, we will be surviving. Others say they were not confident. Maybe this is the time that we also have to discuss what survival means. What I mean by that is maybe survival means partner with our neighboring congregation. We don't have to do by ourselves. Maybe survival means merging with our neighborhood congregation or the nearest congregation, ecumenical partners, whatever. So survival means maybe it is holy closure. We have to close and move on and use that resource for rebirthing of another minister. So, so we have to probably address those issues going forward. And all of those is faithful discussions. It's not about lack of faith, or it's not about days. It is about faithful discussion of doing ministry together.
I think that what you're talking about is very important, and as a part of that, I said when the social distancing or spatial distancing had first come about, and it talked about church closures, and I'm very happy that most of our leaders and bishops have encouraged special and social distancing, particularly for our congregations. But I said at first it wouldn't affect many of our congregations because less than 25 people worship in many of them anyway, right? Like as a whole, and that's across the board, not just congregations of African descent. So Pastor Cheney, what needs to happen next in strategic evangelism? Like, so let's say we don't get to go back to church for another 6 months or a year, right? What does invitation look like in right now and afterwards? So how can we prepare for strategic evangelism? What do we need to do?
So I think one of the first things we need to do is to remember that and I think this is true of evangelism all the time, but particularly now, is that it has to be rooted in relationship and care. It has to be rooted in love for the people. And I say that because our communities are reeling. There are people who are sick. There are people who have lost their loved ones. There are people who have lost their jobs. With no hope of when that might come back. They cannot easily go and find another job. There are so many different implications, people struggling to pay their rent and so on. And the lines for food services are wrapped around parking lots and buildings and so on. And when I think about evangelism is not going to look like you printing out a glossy flyer and handing them a flyer to invite them just to your regular Tuesday night or Sunday night or whatever. Right. First of all, they don't want to touch it. Let's start there. But also, when people are reeling, the very thing that they're thinking about is not about coming to do a thing that they've not been doing before, and that is not rooted in care for and in consideration of the very things that are most central to them right now. And so I think I've always talked about having multiple front doors to the church. We often think of the front door of the church as people coming into your building on Sunday morning at 10 o'clock or 11 o'clock or 9 o'clock or whenever you have worship. But my experience in ministry has been that there are often many entry points to ministry that comes. And now that front door may be a completely different entree into ministry for people that is rooted in caring for them where they are right now, and being able to, when we talk about messages of faith and hope, of living that with people on the ground in the midst of the things that they are going to. So that would be the first thing that I would lift up. And the second is that we cannot forsake that online audience just because we can get back into our buildings again. That would be the worst lesson for the church as a whole. And I speak not just of the Lutheran church, but for the church as a whole, that there's been so much engagement that has happened through remote means that on the days when the doors can open again to our buildings, we can't close our laptops and tablets and phones and disconnect, stop paying the $11.99 or whatever you pay for your Zoom account or whatever the case may be, and go back to business as usual. That would be the worst thing we can do. We have to continue to be able to engage people through these new innovative ways of doing ministry. We have spent plenty of time trying to figure out how to do ministry differently over the last 4 to 6 weeks, and we have to keep that as a part of our model of ministry. So reach out. I was talking with someone, a pastor who is now engaged in rural, in radio ministry because they live in a rural area, and so Wi-Fi signals are not strong, and so the particular area way that they engage in ministry is through a joint radio program with another congregation in their area, and in thinking about what that might look like when we are able to go back into the building, but maybe that becomes a front door of ministry, particularly for a person who might be a little bit uncomfortable walking into the doors of the church. Perhaps these kinds of mediums that we're using become a way to make people more comfortable, that maybe that leads them to join us in person, and maybe they never join us in person. But if our goal is to be able to share messages of hope and faith, as we said in one of our very first slides that we talked about today, then we need to keep up what we're doing as a part of how we share the gospel.
That's going to be so important. I say also two things. The first is, according to what you're saying, is to have ready an updated website. Like our websites are so haven't been changed in months and years. And if there's nothing, I'm learning how to master Zoom right now, like reading and to do webinars and making sure that I have it, down packed. Like many of our church leaders, if you've got to find ways to either find lay people or somebody to help with these church websites, because I Google everything. If I want to know something, I literally Google it. And again, I remember years ago, almost 15 years ago, that's how Pastor Cheney found the church I served in Atlanta, because we had an updated website that was able, and thank God, and now she's a pastor in the church, the ELCA. So we're grateful for that. So making sure that your websites are fresh and appealing and updated, so that people know. You shouldn't still have on your website that you're having service at 11 a.m. on Sunday morning and a 9 a.m. in a Bible study, at your location. It needs to be pointing people and driving people right now to your digital platforms and those capacities. The second thing I think that we've got to, I always believe in looking at what other people are doing, right? Because there's nothing new under the sun. And I'm watching the Jehovah's Witnesses and the Church of the Latter-day Saints, and I want to know what they're doing, because they have an evangelism strategy that compares to none. I mean, they are out there, right? And I want to watch how they are shifting. I don't believe what they believe, but I believe in what they're doing, their practice, their method. And I want to see how they plan to shift in this current time, in this digital age. I'm here in New York. They're at every station, every subway station that you can have, sitting outside all day long with their tracts. And again, as we talked a few minutes ago, people don't want to touch a piece of paper no more. So what will their practices be, and how they're shifting? Again, they do evangelism well. I just want to find out how they engage their methods. Dr. Burley.
Can I say one thing about websites real quick? One thing about websites, we talked earlier when we talked about staffing, that for many of our congregations, they don't have significant staff. We've also talked about engaging lay people and so on. But even if you don't have the resources to be able, then I'm thinking people resources to fully engage and regularly update your website. Have a good static page up. That if you have one static page that has the most recent information, we don't necessarily need all the bells and whistles and all of that. Just have good content that is there and that remains relevant, because that's what people are looking for. The same is true for your social media as well, that for many congregations, their Facebook page is the first place that people engage them, and now Instagram and others. Make sure that we're keeping those fresh, because that's where people are learning more about ministry.
COVID-19, we talked about it disproportionately affecting people of color or Black people in particular, really. And even the Latinx numbers includes people of African descent in the Latinx community. So even though their numbers seem to be big, and this is not to minimize anything, we have to realize the ethnic context here that is a construct within that number. So the numbers may be mixed up a little bit. But Dr. Burley, the thing that concerns me the most and that we need to pay attention to is growing younger. So as COVID-19 is disproportionately affecting people of African descent and people who are over the age of 65, right? Particularly because of aging conditions. So there'll be more deaths of older persons and things like that. And some of that's natural. Some people we hate to see any loved one go. But how are we going to focus as a church on growing younger? How are we missing the mark right now with younger populations? And can that be corrected?
Sure. Well, I think it harkens back to my earlier comments about this box that faith has traditionally existed in, and the need for destroying the box, essentially, and doing faith outside of the box. And so that means not only being a church that accepts all, but a church that affirms all. Mm-hmm. Those two things are different, right? It means being a church whose doors are genuinely open for whoever presents themselves. It means being a church that is amenable to singles ministries and to direct leadership and involvement from same gender loving persons, and churches that embrace and affirm ministry outside of our tabernacles. And so, you know, some of the most thriving churches where young people attend is at a bar in Harlem. I know colleagues, young pastors who have, you know, wine and scripture or something along those lines at a pub. And young people are showing up in droves to hear God's word in a way in which identifies with their social context.
I would be there right now. It's Sunday afternoon.
Right. And so, again, I think COVID-19 has given us a moment to be agile, to be nimble, to be flexible in the ways in which God is calling us to do ministry. I hope that we don't leave that agility with this moment. I hope that this moment creates a movement of a new church realized, one that, you know, people come to Christ in ways in which, you know, otherwise haven't been traditional. You know, we've been having church over the phone because I'm a part of a membership where people are too old to engage Zoom or, you know, Facebook or Instagram Live. And so we have to do worship over the phone, and we preach over the phone, and we pray over the phone. We even have someone sing over the phone. And I've been encouraged because you realize that God is present.
Yes.
And that it was never about the building, that it was never about, you know, the cross, that it was never about even the physical table, that God is present wherever we are, but even where we are not. And I think that's been encouraging for us to be able to have a full worship experience, even with the sacraments. We had Holy Communion over the phone, where we just told people to, whatever cracker or wafer or bread you have, and whatever fruit of the vine that you have present in your house right now, let's get that and let's commune with God. And God was no less present in that moment.
Uh-oh, that's a controversial thing in many of our chat sessions in the ELC.
I'm sure. I'm one of those moments where I'm glad that I am not of the call, so that I don't have to engage in those particular chats. We just do it, and we give God thanks for God's blessing and God's presence, even as we convene over teleconference lines. But needless to say, young people are people of faith. Young people are people who believe in a higher being, regardless of what we call him or her, and regardless of where we seek out that higher power, whether it's a church or a bar or someone's home, living room. And I think that we have to embrace that flexibility so that young people will continue the church. It just may look different from the church of old. And so this is the proposition that I, bring our members all of the time who are aging, as we have embraced and entered into conversations about ministry sharing and new ways of not only surviving, but thriving. And I say, if you love this church and this is a church that you want to see be viable in the next 20 years, then will you be willing to reimagine the ways in which we do church so that that might happen? To let go of old constructs, to let go of old boxes, to let go of kind of traditionalism, and to walk into a new model of evangelism, a new era of ways in which we engage Christ, knowing that God is with us, and that it was the same God that was with us a century ago or 2,000 years ago. And in knowing that, then ministry is being fulfilled. So it's really about agility, flexibility that we're all faced with right now, and holding on to that even as we are allowed to maintain and return to our buildings. And so, as Reverend Chaney mentioned, continue those virtual worship services, or making worship accessible virtually. Continue those phone calls. Maybe every fifth Sunday of the year, of the month. Those months that have 5 Sundays, maybe that fifth Sunday will be the day that we don't come to our building. Maybe it's the day that we go out and we stand on church corners, or we go and gather somewhere else where young people are, if they're not necessarily coming to where we are. And so really just, being
like at a bar,
and just being open to the possibilities, knowing that God is with us, even when we don't recognize him or her. He continues to reveal himself and walk alongside of us over the phone, over Facebook Live, and even in our building.
I think that's very important. The message you're talking about with younger people, I think that's a strategy. That's a strategic model that we should be engaging, that God is with us. And that's so important about what are we saying. We preach Jesus and Jesus crucified and resurrected, but I think the message of hope, right, is that God is with us, right? Right now in this pandemic, we're dealing with, these younger populations have dealt with so much trauma politically, emotionally, mentally, so that there's a need to really share in our growing younger engagement and strategy, to share that God is with us. And I was always told that if God is with you and for you, who can be against you? So that's a reality. I want to share these last 2 slides, and we're almost out of time, but it's very important. I was encouraged by these last 2 slides. that talked about people of African descent in the Lutheran tradition and their sources of support and about our organization. Pastor Cheney?
So again, we asked where our participants were finding support for themselves and their congregations, and what we got was a multidimensional response. We received responses both of church-centric sources, our synod offices and bishops ranked as the highest source of support, and community-centric sources of support, our state and local government leaders and news and media outlets. I think as we talk about this, though, it is important that we think about how and where we receive our information and use discernment to ensure that we are using trusted sources as we engage. And then we asked about our primary chapter ADLA priority for their ADLA chapter. We know that ADLA has 6 priorities, and the respondents found that strengthening leadership and congregations was the most responded, that was the priority for their chapter. And of course, that is going to be particularly helpful in this season as we think about how we strengthen our leaders and our congregations going forward.
This is very important, and the reality is that as people of African descent in the Evangelical Lutheran Church in America, we are truly connected. We are not aloof. We're not a people who don't know what's going on. We're connected to our synods. We disproportionately probably have to fill in, some call it tokenism, but we talk about active engagement and investment and participation on various Senate committees and national committees. So we're truly connected to our synods, our bishops, our church-wide expressions, and particularly our local municipalities, and knowing exactly what's going on. Many of our leaders are first responder chaplains and other organizational leaders, and obviously, again, healthcare workers and things like that. One of the things that I want to lift up too is that sharing the fact of our economic access. The ELCA Federal Credit Union has been approved as a site and an opportunity for us to apply for PPP loans and getting those fast tracked. And I'm finding, and I'm looking online, and I see many individuals participating in that and having good access. And I love that. And some of our leaders, Eva Roby and others who are serving in our church-wide expression, have quickly responded in a way. And we need to find ways to connect our churches of African descent to gain access so that we can move away from some of those decreasing numbers of staffing. And actually, the reality is we may need to find ways to increase in this next entity or iteration of what the church will be. Also, lifting up, finding better ways to engage and reimagine our purpose and our connection with Lutheran disaster response and other entities like that can also help us in this pandemic as well. So we are truly connected, and I'm grateful for that. And many of you know, you can look at our ADLA website, which is www.adlaelca.org, adlaelca.org, where you can find our priorities as an organization. And we're working very hard at expanding and engaging. And historically, we've been engaged in dealing with social determinants that have disproportionately affected people of African descent's health. We've worked strongly with the HIV/AIDS community leadership globally, internationally. So that's something that we want to keep going and engaging. We want to be on the front line, if you will, of advocacy for resources about understanding this pandemic, regarding race numbers regarding reporting on how this is affecting people of African descent. We want to do that, and we're participating with the ELCA Advocacy Office with that as well. We talked a little bit about some steps to take to re-engage us for our future, right? And one of those steps, Pastor Amsalu, you talked about, is creating lay education centers. So we want to protect things like LTCA, the Lutheran Theological Center in Atlanta, that has a good way and opportunity for us to host anti-racism training, to do immersions so that people understand urban immersions or taking the plunges there so that people know how to do ministry in various contexts. And also lay school training, which is also, you know, I love that our Latinx community has multilingual schools and things like that they've engaged. And this is our epicenter, if you will, and we've got to find a way to better utilize that. We have sub-centers at our theological school in Chicago and our theological school in Philadelphia, like the Urban Leaders Institute. But I'm talking about institutions organized particularly for lay people and in a different context that can serve as a national center, if you will, for Black Lutheran education. The next thing that I also think that we need to look at is getting coaches for all of our pastors of color, and particularly people of African descent. And making sure that in this time more than ever, I believe every pastor, again, like I said before, needs a coach. But I think in this particular time, with the different levels of things that pastors of color and African descent have to deal with, issues that are systemic issues, right? This is not just crisis issues, right? Crisis is a moment, right? But these are systemic issues. We're going to need coaches to help guide us through this and pull us through in a healthy way. And the last thing that I think that we need to continue, and people talked about ADLA as a various chapters engaging in very clearly, is the upcoming election and every election, right? We don't want to get so focused, and we do have to focus on this pandemic, that we also don't realize that there is an election that is occurring that will deal with many of the things that we're faced with now. The systemic change that's needed can be shifted by electing the right leaders, right? So when Luther talked about how to deal in a pandemic, he basically said of mayors and other municipality leaders that they need to stay in place because that's what they're called to do in their job. And we're seeing, you know, everybody loves my governor right now, Governor Cuomo, and all of his stuff that he's doing. And, you know, they tell me that your president of the United States, yet to be United States, they had to stop his press conferences. But, you know, neither here nor there. The reality is that we've got to stay engaged in the political process, because if we don't, then these things that we're dealing with systemically will continue to exacerbate themselves and will grow in a deeper hole. And we want to come out upgraded and come out victorious and as we continue to live our best lives. So in conclusion, I want to ask everybody, what's happening in our world that we should be focusing on or advocating and sharing and proclaiming? What is the thing right now that you think that we need to most think about in our world that we should be advocating, sharing, and proclaiming?
It's not about sharing the proclaiming, but I just wanted to lift up as kind of a summary, things that we said. One thing we have to kind of do is using the resources that are available to us. I mean, for free. I mean, if you have internet, computer devices, and lighting, you can live stream. And there are some, we don't have to pay for YouTube, but there are YouTube channels and Facebook Lives and Instagram Lives and Zoom. Let's use the available resources that is there for us, and don't be afraid. Maybe ask our youth, as Dr. Burley said, and be led by them to use that. Let them lead. The other kind of known fact I just wanted to repeat is that when we are doing virtual services or Bible study, we assume that everybody who are listening to us know where we are located and who we are and what we are up to. Don't forget to introduce yourself, your ministries, and invite them to be part of, but also follow up with them. If somebody joined and kind of interacted, please just follow and do some evangelistic follow-up. So I just wanted to lift up those.
That's important. So what else should we be focusing on? Okay.
I would lift up relationship and advocacy as two things. Relationship with Christ and with each other, in that the way through this is not individualistic. That we survive this virus as community. So I've seen the meme go around that says the biggest problem here is that it's like that group project where one person didn't do their work and everybody else is suffering and we all got to stay in the house as a result, right? That the way through this is communal. It's the way we get through this season of dealing with the height of the virus, but it's also the way that we recover. That when we're able to leave the house again, we got to help one another. And that's a focus for us as people, and it's, I believe, an important focus for our congregation. And alongside that is advocacy. Advocacy for testing, particularly in our communities that might be more underserved and less represented. As we get into talking about contact tracing, as we get into talking about provisions for people being able to, once the contact tracing happens, to be able to quarantine. I'm blessed to be able to be in this house by myself, right? But that's not the story for so many people that live in other places that will need support for how we don't just continue to spread. And as those kinds of resources are happening in our communities, that we have to be on the forefront of advocacy to make sure that as resources are happening, that they are happening in underserved parts of our communities as well. And I will also say, please take your census while you're at home. There are resources tied to that as well that's going to be important as we look to the future.
Dr. Burley, what should we be advocating for? And also, who should we be listening to? Everybody's on Dr. Fauci and things like that. And so are there any people of African descent who know our story that we should be listening to in particular, besides yourself?
Sure. So there are a number of people who are on the front lines, people of African descent who are providing care, but who are also learning new things each day as this virus changes daily, and then sharing that information with us. The National Minority Quality Forum, which is a nonprofit committed to health equity and people of color based out of DC, is doing tremendous work around engaging the Congressional Black Caucus around the deficiencies in testing and treatment and contact tracing, as Reverend Cheney mentioned. Johns Hopkins University has been the most thorough resource, its Coronavirus Resource Center for me, and all information is being provided for free. They keep a running total of cases, and they've even began to make available racial and ethnic demographic data as it relates to COVID-19, as it is being shared by state and local health professionals. You know, Dr. Fauci, Dr. Birx are credible individuals, people who I've worked personally with on the HIV and AIDS epidemic. They are under the thumb of a non-credible administration. And unfortunately, the longer you work for the circus, the more likely it is that you become a clown. And we've seen that these credible people have sometimes been sucked into this cycle of misinformation that comes from our White House, which is unfortunate, but I still want to say that they are the leading experts on this pandemic in the United States context. The information from the CDC is still reliable. But again, Johns Hopkins is where I've got my information from. But there's also this idea of nothing about us without us, and the only people who can save us is us. And so please be clear that there are people of African descent working tirelessly around the country to deal with this problem. We know that scientists at Meharry College of Medicine are currently working not only on a vaccine, but on a treatment, because they understand the what's at stake here. And so I also want to encourage everyone to take your healing into your own hands. Many of us are in states that have begun to reopen. Please know that these reopenings are premature, and that just because they say that you can go outside doesn't mean that you should go outside. And so continue to exercise good self-judgment, continue to access good information that is credible, and continue to decide for yourself what's best for you and your family in times when our elected officials aren't always acting in our best interest. And know that this too shall pass, but we will have to emerge from this as new people, and new people who exist in a new normal. Things will never be the same. And so again, harkens back to this idea of flexibility. You know, the passing of peace might have to change in the future. The ways in which we engage in the tactile expressions of mutuality, a smile, you know, might become a thing of the past, as many of us have to wear masks now. You know, these are not necessarily assaults on our freedom, but they are what's necessary to make sure that we can continue to exist, you know, not only as people, but as a fellowship. And so know that these moments are only minor setbacks, and that we have a major comeback in store for us. And I'm confident that we will emerge better than how we went in.
Well, I just want to take this time to say thank you to each and every one of you, Pastor Amsalu, Dr. Ulysses, and Pastor Cheney. I just want to thank you for your time today. And in the near future, I want to bring you back on individually, and maybe we'll do an Instagram live where we'll have a real-time opportunity to engage the world community, the Lutheran community in particular, with more information. This particular survey, Checking on the Community, is brought to you by the African Descent Lutheran Association. And again, I'm Pastor Lamont Anthony Wells, the National President of the African Descent Lutheran Association. And you are welcome to receive a copy of this particular survey and the results on our website at www.adlaelca.org. That's adlaelca.org. And we welcome you there to also support us. There is a donation opportunity for you to support this robust organization that is doing great and mighty things to support leaders, to support congregations, and to support the people and the communities around us. With our various objectives. And God is really blessing us and taking us to new heights unknown in the past few years. So to be a member, and you don't have to be a person of African descent to support us. So your financial donations are very important to keep the ministry of this particular association within the ELCA as the voice of people of African descent alive. And also, I would like to give you a open welcome to our biennial assembly, which will be held in Atlanta, Georgia in the summer of 2021, pending that this pandemic ceases or comes down. So you'll find out more information about that again by visiting us at www.adlaelca.org. Again, thank each and every one of our panelists, and you will hear from each and every one of us soon. God bless you. Good night.